What advice would you give other nurse practitioners who were looking for a psychotherapy program?
I definitely would say if they're interested, they should join, even if they are in school and they're not getting that experience. It could be a good way for them to integrate these skills while they're in their rotations. It'd be good if they had cases they could bring in so that they could practice. And I think being in a space where you can practice would be great too. But I definitely would recommend it.
Eric, you have access to the entire program and everything we're doing for literally the next 6 months.
Which I'm very happy about because I find myself referencing back to these things sometimes when I want to refresh material that I feel not great about still, or I feel like I have a hard time understanding. I will say I really, really enjoyed this program. I was so inspired by everybody else and seeing people have similar questions to me and having the same imposter syndrome about therapy. I particularly like the program because you and Doug are psychiatrists. I wanted it from the lens of someone who was in a similar role as me, not so much in the therapist or psychologist role. I figured I could learn practical skills that came from someone who understood what I lacked or what my educational background didn't give me initially. And the second thing is, I just wanted to learn how to help people outside of doing meds. I feel like I'm a people person in general, and I like having a human connection to people. I work for a place where I manage their medications, and it does feel at times robotic because I'm just pushing these prescriptions. I talk to them for 5 seconds, some basic questions, and then refill, see you in 3 months. I always knew that about going to school and what I liked about psychiatry, but there are parts of it that I felt like I wanted more time with people and I wanted to have a better connection to them and feel like I was providing really more holistic, comprehensive care as opposed to just like, this is your diagnosis, these are your drugs, it's going to be your life now. When I think giving people the chance to talk and have skills to make their lives better, that's what this program gave me. And I'm glad to have been able to participate in it. And I'm excited for the future. I think something that I didn't expect from the program is that although I've learned a lot and it is practical, it makes me want to learn more and go into more, like read more books. Like I bought like a couple CBT books, and then it segued me into looking into solution brief therapy. At the same time, I also learned the niches that I feel not comfortable with. The last module was psychodynamic. I watched the recordings every week after you guys finished them and seeing like Claudia participate in them. And I'm just like, wow, she's really meant for this kind of work. And I'm so happy that she is finding her niche and what her calling might be. For me, stuff like CBT makes more sense. It's a little bit more algorithmic, and there are certain fixed questions I can tease out details. Having worked in the ER and in family medicine, I have a more of an algorithmic approach to things. And, the psychodynamic approach is so abstract to me, and it's very interesting and important, but it doesn't feel as natural to me. So maybe down the road, but I feel like I want to tackle one therapy at a time where I could feel like, hey, I kind of get the gist of this. Now I can incorporate these psychodynamic components or motivational interviewing. But it's been a really good experience.
I was really struck by a couple things that you mentioned that really spoke to me. You didn't know much about what you didn't know, and then you came to us because we had something that you didn't have, but we had the experience that you wanted to have. You did the program and you were exposed to all of these different psychotherapies, and you felt a pull to some, and you were kind of repelled by others. And that's what growing and developing is all about. You hold on to what works for you and figure out how to do it better. That'll lead to more career satisfaction, better outcomes for your patients, because when you're invested and feel confident in yourself, that's going to shine onto other people, and they're going to say, oh wow, Eric really knows what he's talking about, even though he's a PMHNP. What I know about PMHNPs is that they don't have as much experience as psychiatrists many times. He's still someone I enjoy working with. He can relate to me, he understands me, and he's just such a personable guy. Going back to supportive therapy and enhancing the rapport between you and your patients, that's really the most essential thing. Because what happens a lot of the time when you're talking about your experience, a very busy practice, ask a couple concrete questions, send them on their way, and I won't see you for another 3 months, and I'll have to refer to my notes to remember who you are.
Right.
You're looking to develop personal connections with people.
Right.
That's going to give you the biggest benefit. The psychotherapies will give you a general scaffolding to move around because you'll be able to identify in other people what they're going to be most receptive to. Now you're going to be listening with the ear, like, oh, you're going to be great for CBT. I'm really great at that. I'm going to take good care of you. But oh, I'm hearing some psychodynamic aspects that maybe this person would benefit more from. Maybe I'm going to refer to someone who could do psychodynamic psychotherapy better than I can. So
Right.
now you have a fine-tuned ear so that I can work with people and I'm going to feel really great working with this kind of person, but maybe I'm not the best fit for this person.
Sure. Yeah, I mean, it's definitely, I feel like I'm very fortunate to be in places and to have the eagerness to go seek out opportunities because, I saw your guys' business and what you guys had to offer. And I had been searching for different types of programs out there that offered psychotherapy, but there really wasn't a specific niche for people like us to go and learn from scratch. So it was a little bit daunting finding programs. Through the power of social media, I met Rachel, who has her own presence in the social media psych world. And she advertised the program, and I thought, oh, this is actually really cool. The more time I spend looking online for these fellowships, I think with the duration of the program, the frequency of the meetings, the ability for it to be virtual while I'm working at the same time as a newer clinician, it just made the most sense to me to start this type of program. I couldn't afford to move halfway across the country and start a year or year and a half long fellowship. As much as it would be nice to do so, it's a financial thing, it's a comfort thing. Having a program where I could be in my own space and meet people for an hour and a half every week spoke to me. I feel inspired now that this program's over. This is the tip of the iceberg for me in this field, and there's so much to learn. I feel grateful that I still have a drive to keep moving forward with my career. I want to get better and learn more skills and help people as much as I can because I feel like the more tools I have, the better prepared I am to help a wider audience. So yeah, I'm very grateful, and I think that I'm just excited for what the future has to hold.
Yeah, daunting. I also considered doing fellowships and additional
Yeah.
training even after my 4 years of residency experience. And I came across the same thing. I don't want to move across the country, live somewhere new, miss out on all of my friends and family, what's going on back at home, and spend a lot of money moving. It's a huge sacrifice. So, yeah, I mean, virtual, you can meet anyone from anywhere. You're over on the West Coast. I'm here sitting in New Jersey. Fortunately, it's good today. It's a big sacrifice. So I'm happy to hear that it was something accessible and valuable for you in all those ways.
Yeah, definitely. I'm for sure also excited at this new practice because my boss was one of the directors of my Psych NP program at the college I attended out here. He's someone I met through the program, and he happens to be a really stand up, ethical guy. I like the way he practices medicine and business. It's a place where I could practice safely. I could have the luxury of time if I choose to with my patients. He lets me pick how long I want to do follow-ups for. He was like, just bill appropriately. If you need 45 minutes for a follow-up, take 45 minutes. If you want to do therapy with them, make your appointments longer. If you need longer consult time, just let me know. But it doesn't feel like I'm in this managed care system where I'm pressured to push volume all the time. As many slots as I can. I feel like I have the luxury of time in my hands to choose when I want to work, when I want to be in the office. So I am very excited because I think this will allow me to tease out my psychotherapy career a little bit further. I don't feel comfortable doing a full psychotherapy session in itself, but I would like to start by incorporating that into my visits with my patients. So that's what I'm most excited about.
And also what our program maybe doesn't say as explicitly as we should, but just because people enroll in our program doesn't mean that you have to be exclusively a psychotherapist doing long therapy sessions regularly. What we wanted to show people is that you can be a prescriber and use high yield and practical psychotherapy skills even with limited time.
Sure.
So I'd like to ask you, in your current practice, even though you sometimes feel pressured to get through visits really quickly, did you find that learning all of these psychotherapy modalities and the Psychotherapy Essentials program was helpful for you, even with the brief amount of time that you had with people?
Yeah, it definitely did because there were moments where I had not a follow-up after a patient and a patient wanted to talk to me longer. And you could tell there's stuff they wanted to discuss outside of the medication follow-up questions. And having those acronyms like the ARISE acronym and thinking about the motivational interviewing questions, assessing if this person's ready for change or they're just saying these things. And being able to ask those questions off the top of my head from remembering them from the PowerPoints and the lectures, it just felt nice knowing that I have more to offer than just, hey, these are questions you got to save for when you see them this week, but I'll see you next month. Is that okay? I think feeling like I could just offer them a corner where they could elaborate on their issues and feel human for a second, that was the biggest part for me, feeling comfortable talking to people in psychiatry, especially with how we're trained in school. You go through these medications and discuss everything related to the medication, but do they really teach you how to talk to people the right way? We definitely didn't get that. And I felt that in my rotations. I would go through these visits and be like, hey, we got to wrap up now. Sorry, we can't talk about this issue with your wife or your kids that's bothering you. We just have to go talk to your therapist, or I'll try to get you a therapy appointment, but we don't know when that's going to be. So I think just being that space for someone and knowing that they don't have to go home feeling not complete or feeling like they still have things bottled up is a nice feeling for sure.
Yeah, and what you were telling me before about you looking for a program that helped you pick these skills up, and it was really in alignment with who you wanted to learn it from, you're recognizing that your patients are also looking for that same level of connection. They want to feel connected to someone that's actually going to listen to them and take them seriously.
Right, right. And I think that's totally true. And I feel like what I learned is that patients mainly want someone that's going to listen to them and provide some kind of feedback. It's not like they come to you knowing they want CBT or knowing that they want DBT or whatever, the psychodynamic approach. They're like, oh, are you a psychodynamic therapist? Great, and this is going to work. They just have normal people problems and they want to discuss that with another person who can provide a connection for them, an outlet for them. And whether that's you listening a bunch and asking them 2 questions or none at all, I think people at the end of the day just want to feel like the other person at the end of the table or screen is listening to them. Having done this program, I feel like I can talk to people a little bit better than I did before. And obviously, time is an issue with my current practice, but I feel a lot more prepared than I was 6 months ago.
That's pretty remarkable. And how crappy of a feeling was it for you to tell people to stop talking about something they thought was important, but you didn't have time to get into it?
It definitely feels crappy. Like you're shutting down a person who is trying to open up for whatever reason, whether it's time or you don't have the capacity or the ability to listen to them appropriately. And it also feels crappy on your end where you feel like I'm really shutting down a human connection. It's like a friend would, if you're like, hey, sorry that you broke up with your person, but this is the end of today's visit of our hangout. It's time for you to go back to your house now. I don't have the capacity to listen to you anymore. See you tomorrow. Just knowing that we can do that to people because human connections and words are so powerful. If you just say, hey, this is for your therapist, I really can't talk to you about this. I think it's such a crappy way to end a conversation with someone who you're supposed to have an ongoing relationship with. I think that sets the tone for the kind of professional relationship you'll have with that patient too. Like Eric's the kind of provider that shuts me down when I ask him questions. So I know not to ask him about this. I should see my therapist. I can't talk to Eric at all. I don't want to be that person. So definitely it's a crappy feeling and it'd be nice to not have to feel like that.
And you actually had the courage to admit that this was something that was really getting under your skin. And you were saying before how your current practice doesn't allow for time because you're pressured to churn people out versus now you have the flexibility to do it. So you actually had the courage to go from somewhere that you were personally feeling uncomfortable to go somewhere that you felt was going to be a better fit.
Right. And I knew that going in, when you're a newer clinician, you can't always pick the best scenario for yourself. It's kind of like, hey, I'm new, I want experience, I'm going to take what I can get. And this is an open door in front of me to get some experience under my belt. And, I'm grateful for it. It works. But is it my ideal end all place that I want to be? For sure. It's definitely not. But I've learned a lot. I've learned what I don't want in my practice. I've learned what things I do want in my practice. And I feel fortunate to be able to move forward in a place where I could gain a different kind of perspective or a different kind of experience that I feel more in tune with.
Yeah, and believe it or not, doctors don't quite get to choose where they do their training when they finish medical school. They go through a match process most of the time.
Right.
And, so what if you get matched at a program that was at the bottom of your list?
Right.
Then, I'm just trying to draw some similarities between the
Sure.
nurse practitioner route in
Sure.
psychiatry. In medicine, even doctors will work in places where they really don't want to, but it's just the next step that was available. There's actually some similarity there between nurse practitioners and doctors. I really think that more doctors need to be supportive of nurse practitioners and give them the skills to do the things they're hired to do, to be able to connect with patients, to gather basic data of what their patients are experiencing, what kind of thoughts they're having.
Sure.
If they're feeling suicidal or severely depressed, they're going to say to themselves, like you said, oh, well, Eric doesn't really care about my problems. Why am I going to tell him that I'm going to kill myself? He's probably not going to care. I don't imagine anyone, I hope no one ever says that.
I hope not either.
But it's a scary thought. How far does greed for turning patients in and out of a practice, how far does it go? And that really scares me. And that's one of the reasons why I started a private practice, because I wanted to have control over how much time I spent with my patients, and I wanted to be able to connect with them on their level and not be pressured to give them something that may not be good for them, like prescribing a medication when really they would benefit from speaking with a certain kind of therapist and doing some cognitive restructuring and,
Right.
and supportive therapy. Sometimes what people need is someone to connect with, and that can be healing in and of itself. We don't always have to prescribe medications.
Right.
Do you have any particular success story that you've had working with any patient while you've been taking the program?
Yeah, actually, this is kind of ironic. I wouldn't call it a success yet, but it feels like success to me. I had a patient that I was covering for one of my colleagues in my med management practice. She had come in, I think she was on Wellbutrin and some other medications, but she had come in to see me and I said, hey, my name's Eric. I'm covering for John. He's out, but I can help take care of you today. And she came in. I did my normal medication follow-up questions. At the end, she started telling me about her sister and how she feels upset about their relationship and her lack of relationship with her brother. She wanted ideas on how she could proceed with the situation or who she should talk to. I remember feeling in that moment like, am I supposed to wrap this up now and let her know, like, or is this what she's here for? Is she here for like a little bit of a brief counseling session? And it's funny because I think we had just gone through the motivational interviewing module at that time. And I was like looking at the clock and I was like, I don't have a patient after. Let me sit here and talk to her, see what she wants, what she's trying to get out of this. When I asked her, do you also like participate in therapy or do you have someone that you see on a regular basis? She told me that the person she normally prescribes her medication talks to her. And I said, oh, okay. So I opened the floor and I said, make yourself comfortable. Let's talk about what's going on. I started asking her questions and did a little bit of motivational interviewing. And I felt like she had a couple light bulbs go off in the middle of our session. Going back to what I said, just having that open connection with somebody. I told her at the end of the visit, did you find this helpful? to talk about these issues. Like, yeah, I definitely felt this helpful. I think that I'm going to go do this with my sister now. I'll call her today. I told her at the end of the visit, I said, I know I'm not your normal person that you see, but if you ever feel like John is out or doesn't have an appointment time that works for you, you can always see me. And I have no problem talking to you or doing a follow up with you. And she was like, oh, I'd actually really like that. A couple weeks later, she switched over her care to me. I talked to my colleague and I was like, hey, I'm so sorry. I didn't mean to steal your patient, but I just left the door open for her. And I said, if she ever wanted to follow with me, I had no issues with that. And he was like, no, she's actually really friendly and I enjoy talking to her. So if you enjoy talking to her and she enjoys talking to you, then go ahead and do what you want to do. And so I guess she's my patient now. So I'm here next
Oops.
month, but we'll see what happens.
You met this person you never met before. They're not even your patient. And you made such a connection with them. Like you said, you left the door open and
Right.
she felt more connected with you than she did with your colleague. You weren't intentionally going into it like, oh, how can I get even more work for me to do in this practice? Uh,
Yeah.
you were just being yourself and practicing the skills we taught you.
As I was going through it, I felt like, the light bulbs were going off and I was like, okay, I think I'm doing something right by this person right now. So
You were even going through it in your mind as you were speaking with them. You're like, okay, did it? So I'm saying this now, and I'm getting that feedback from her in the moment when I'm purposely enhancing our rapport or building
right.
our rapport. And she actually responded positively.
At the end of the visit, it felt really nice. I just felt like I could do something for someone outside of what I'm normally hired to do. And I think just having that skill set makes me feel more vulnerable to patients. And I think patients receive that well, that you're just another human being who's trying to help them out. I feel fortunate because I have some associate therapists in my practice, and because they're so fresh, they're eager to also teach other people. Last week, I made this binder of anxiety, depression skills, and my thought log, the fun stuff you can do with your patients. And she was so excited to show me all these tools. She printed this theories list for me with Gestalt, Adlerian, and all these different types of. I just thought, wow, this is so cool to learn all these things. I wish we had the opportunity to go through these more thoroughly when I was in school, but we didn't.
It's so difficult for these nurse practitioner programs who really have a very standardized curriculum. And
Right.
I just heard from other people that have taken our program and even other nurses and nurse practitioners going into training that they felt like their program was actually just trying to get their money and get them out the door. And even if they were failing, sometimes professors were told to figure out how to pass the student in order to take their tuition. I've heard stories like this. Is that something you've ever come across?
Yeah, and I think this is the problem that I have with. I love my profession and I love what I do for my patients, but I do feel like in the NP world of things, it's a little bit more blurry in terms of education and training. It's not, I feel like in high school and in med school, you have a very rigid structure for how you do things and your rotations and your hours. In the NP world, it can be loose depending on what school you go to or where you're trained. I feel like because I went to a more brick and mortar type of school, I had the right resources, the right training, the right education by the right people who cared about my education and doing things the right way. I feel fortunate in that sense because there are people who I did rotations with and they came from other schools, and I could see that, it wasn't their fault, but their school wanted them to do XYZ, and they clearly weren't prepared to do certain things. I think that's what makes the NP world hard on so many ends. Like, you have schools that are good and then the schools that are not so great. And then we have our MD, DO, PA colleagues, and we have a certain presence and light that they see us through too. And it's variable what you ask their opinions are in NPs. Like, it can be great. Like, there are ones that they work with that are great. And there are ones that are just like, oh, you could tell they're like NPs and they're not that great, or they don't have a robust training experience. And it sucks to me because I feel like I'm someone who always wants to learn and be better, and I'll continue to do this. It sucks that this is a representation sometimes of what's out there. There needs to be standardization of education
Mhm.
because this is where you have not as great providers. Providers should be good at what they do and be knowledgeable and experienced, but not everything is done the same way. I actually talked to my new boss, the assistant director of our program, and I said, it's something that I wish we did was have more therapy or at least therapy hours required in our training. And he's very involved in the curriculum. He took a break for a year, is taking a break this year from school, and he's helping with the curriculum to incorporate the therapy portion. So
He really took your feedback on that.
he's actually someone who believes in that therapy stuff himself and has always told me that's what he wants to incorporate in his practice. And so he told me when I finished school that, to get experience first, but he said, like, if you can get some therapy experience or go learn or read some books, because I want to have a practice that will incorporate this for our patients too. And so I took it upon myself to figure that out and get some experience. And I'm grateful for that. I wish that our education included that to a higher degree, but now I'm learning in a different way. That's what I feel about the whole education thing. I just wish it was a big part of it, because part of me questioned whether or not I should go to become an LMFT. You know
Mhm.
what I mean? Or
I
go
do
get
know
my
what you mean.
yeah, or like go get my PsyD while I'm at it, Like there's so many things where I felt like, dang, there's a bigger part of psychiatry or mental health that I don't feel that adequate about. And why do I feel like that? I wish it wasn't a thing.
Some things about even in other healthcare, even in chiropractic, you have different types of chiropractors, ones that focus mostly on the mechanics of the body. And then you have a school of chiropractors that have a more integrated and deeper appreciation or belief in the structure function relationship and how different diseases can manifest from misalignment. And so there's different schools of thought in chiropractic, and generally speaking, any program has strengths and weaknesses.
Sure.
In psychiatry in general, there's a rapidly declining amount of psychiatrists practicing psychotherapy, psychiatry being a medical model of mental illness or mental health,
Sure.
and psychology, right? So your psychologists, your licensed therapists, counselors, etc., they're the mind part of it. So then how does psychiatry overlap with psychology? They both deal with the mind. And like you were sort of saying, you didn't mean to step on your colleague's toes. The patient just preferred to work with you. It wasn't something malicious. You did something that a therapist is supposed to do. You stepped out of line. How dare
Right.
you? That's where I have a big problem in the healthcare system, especially as it relates to psychiatry. It's so much easier, actually, if you think about it, to have a checklist and to ask very concrete questions and then adjust medications according to your concrete questions. It doesn't require much thought. It's
Right.
a robot can do it, really. Soon, I wouldn't even be surprised if people are going to fill out a PHQ-9 and adjust their medication from there, which would
Right.
be a very terrible thing
Right.
to happen. I
Right.
hope it doesn't get to that. What I'm trying to say is that in the fundamental evolution of psychiatry as more of a medicalized specialty, as opposed to an integrated specialty, including psychology and therapy, in addition to medication management, you really lose something in those clinical encounters. Oftentimes, even psychiatrists need additional therapy training because their program didn't provide it.
Sure.
The general belief is that if you're a prescriber, you need to prescribe.
Right.
And insurance companies will only pay a loud amount for the services you bill for and take away the opportunity for you to earn the money that you're looking to make based
Right.
on skills and knowledge that you have, and for people come to you because they have a problem they want fixed. If people have a car problem, they're going to bring it to a mechanic. It's not always covered by insurance. Same thing with healthcare. If something's wrong with your body, you need to figure out what's going on. You can go in network, but you have long wait times because people fill up with insurance plans. Then you have doctors and other prescribers who um, are under the same pressures that you are because you're just trying to make a living. And there's different financial arrangements. Maybe you make your living by seeing more patients because you get more money. So now you're incentivized to provide a worse quality of care. It's a double-edged sword. And the natural evolution of the healthcare system churning out people to do high volume work and low quality healthcare, which is really not in anyone's best interest. It makes you unhappy, it makes patients worse off, but it makes a lot of insurance companies really rich.
Right.
So
Let me ask you a question.
yeah.
So I remember way back, you mentioned a good way to know what therapy is like if you've never done it is to get it yourself. Get therapy yourself. If I don't have something or things that I consciously am aware of that bother me, do you think that would be a ridiculous way to approach starting therapy? Do you think my therapist would see that as a, what are you even doing here? Or do you think they might uncover some unconscious thoughts that I have about certain things?
I guess I would ask you, what would your motivations of going and being in your own therapy do for you? Typically, having a goal or reason to seek out a therapist and do psychotherapy for yourself would help guide things. If you're someone who has everything put together and you really don't have any issues going on and you're actually really happy with life and you're just really easygoing, maybe you won't have so much to talk about. But once you do, I think what you might come to learn is that when you work more with patients doing psychotherapy, it's really important to have supervision at the same time, because it helps you check yourself and
Sure.
it bring to light some complications of, oh, well, why did you feel like yelling at this patient but you really get along with this patient? and
Mhm.
now and now you're sort of building an understanding of, oh, I didn't realize that this type of person really bothers me for reasons X, Y, and Z.
Mm.
Oh, I remember having some really terrible experiences with people that have these types of character traits, and I remember this really terrible experience that left a big impact. Wow, I didn't realize I would be talking about that today in supervision. That felt really personal.
Sure.
So even supervision could feel like psychotherapy from time to time, because there is an overlap. It sort of stems from the purpose of, how do I become a better therapist, and how do I understand myself better so that I can more smoothly or
Sure.
accurately help my patients and what they're going through.